Hello friends, welcome you all to my channel Healthy Life. Friends, in the last video I have discussed about the irritable bowel syndromes, its types, symptoms and causes. And in this video I will discuss about the diagnosis or test and treatment of irritable bowel syndrome. So friends, before start the video, if you didn't subscribe my channel, then please do subscribe, and if you like the video, then please do click in the like button and share with your friends. So friends, the diagnosis and test of irritable bowel syndrome. How is irritable bowel syndrome diagnosed? The first step is diagnosis of irritable bowel syndrome is a detailed medical history. Your provider will ask about your symptoms. They ask you, do you have any pain related to bowel movements? Do you notice a change in how often you have a bowel movement? Has there a change in how your poop looks? How often do you have symptoms? When did your symptoms start? What medication do you take? How you've been sick or bad, stressful even in your life recently. Depending on your symptoms, you may need other tests to confirm a diagnosis. There isn't a single test to diagnose IBS. Instead, your provider will determine if you have IBS by asking about your symptoms, making sure you are up to date on your colon cancer screening, checking that you don't have symptoms suggesting other disorders. Lab tests like most lab tests exclude other conditions that may be causing your symptoms like an infection, food intolerance, or a different digestive condition like inflammatory bowel disease. Not everyone needs the same test. So the few tests are like blood test to check for a digestive disease condition for another condition that may cause your symptoms. Stool test to check for an infection or signs of inflammation in your bowel caused by a digestive condition. Hydrogen breath test to see if you have an overgrowth of bacteria in your gut or a food intolerance. Imaging test. You may need imaging procedures to rule out conditions involving inflammatory or abdominal growths in your GI tract, like colonoscopy can help your provider determine if you have certain bowel disorders that may be causing your symptoms, including polyps, IBD, and cancerous growth. For the procedures, a provider inserts a scope that allows them to view your entire colon, flexible sigmoidoscopy. Similar to a colonoscopy, except a provider inserts a scope that allows them to view the lining of your rectum and the lower part of your colon only. And upper endoscopy can help your provider diagnose celiac disease or other GI condition. This procedure uses a scope that allows your provider to see inside your esophagus, stomach, and the first part of your small intestine. So these all are the test or diagnosis of your irritable bowel syndrome. So let's know what is the treatment of irritable bowel syndrome. So no specific therapy works for everyone, but most people with IBS can find a treatment plan that works for them. Typical treatment options include changing the food you eat and your routine. Medications can help too. Behavioral health therapy may help. Many of these treatments take time to work. They can help your symptoms, but your symptoms may not go away completely. Meal changes. A dietitian can help you choose foods and modify eating or drinking habits to avoid symptoms flare up. They may recommend that you increase fiber in your diet. That is, fiber-rich foods includes fruits, vegetables, grains, plants, and nuts can help if you are struggling with constipation. Introduce fiber slowly into your diet to give your gut time to adjust. Add supplemental fiber to your diet. Another option is to try fiber supplements like Metamucil or Citrusel. Limit dietary products like cheese and milk. Lactose intolerance is more common in people with IBS. If you cut back on dairy, make sure to eat non-dairy food rich in calcium like broccoli, spinach, or salmon. Limit foods that can make you gassy. Foods like beans, Brussels, sprouts, and cabbage are notorious for causing gas, but carbonated sodas and even chewing gum can make you gassy. Reduce these foods to go easier on your gut. Avoid gluten. People with IBS, even those without celiac disease, tends to be more sensitive to Gluten. If you opt for a gluten-free diet, work with your provider to ensure you are getting enough of the key vitamins and minerals often found in foods with gluten. Drink plenty of water. Drink at least 8-ounce glasses of water a day, that is 2 liters a day. Water keeps your GI tract lubricated and can help treat or prevent constipation. Keep a food diary. Your provider may recommend it that you note the foods you eat to determine which foods triggers IBS flares ups and then bring this nutritionist. Activity changes. Changing daily activity can help too. Your provider may recommend it that you exercise regularly. Aim for 150 minutes of moderate exercise weekly. This is about 30 minutes a day, 5 days a week. Moderate means you are raising your heart rate. Try relaxation techniques, daily yoga, medications, and other de-stressing techniques can help calm an overtaxed nervous system and a nervous gut. Sometimes a behavioral therapist can help. Get enough sleep. Aims for 7 to 9 hours of quality sleep each night. Go to bed at the same time each night. A good night's rest is one of the most powerful de-stressors available. Reach out to a provider if you are having trouble sleeping. Now, what is the medications that needs to treat the IBS? Your healthcare provider may prescribe medications to provide symptom reliefs, including antidepressants. If you have depression and anxiety along with significant abdominal pain, medications include tricyclic antidepressant and selective serotonin reuptake inhibitor. Medication to ease constipation, including fiber supplementation and laxative. Medications to firm stools, anti-diarrheal medications to help with intestinal spasm. Although research into their effectiveness is ongoing, your provider may recommend probiotic. This good bacteria may help relieve IBS symptoms. Medication especially used to treat IBS includes dicyclomine, hyoscyamine, and lubiprostone. So friends, this is all about the IBS and its diagnosis and treatment. So friends, if you like this video, then please do subscribe my channel and share with your friends. And in the next segment, I will come with another problematic disease of human beings or information about a new medicine. So till then, take care and bye bye.